Proper maintenance of equipment increases the lifespan of machines, such as the Gradian Comprehensive Care Ventilator. ICU nurses must be familiar with the steps required to clean, prepare, use, and store ventilators. Nurses should verify that ventilator settings match physician orders at every shift. If settings do not match, they should be confirmed with the prescribing physician immediately. Proper management of an endotracheal tube is of the utmost importance for patient survival. There are several potential complications with endotracheal tubes, and they occur quite often. Bedside nurses must recognize these complications quickly and understand how they can take action to correct the problem. Endotracheal tubes can easily become dislodged or pulled out, compromising the patient's ventilation. This commonly occurs when patients are moved, turned, suctioned, or transported. Similarly, the endotracheal tube can be advanced too far into the patient, leading to selective ventilation of only one lung. Nurses must repeatedly confirm that the endotracheal tube cuff is inflated and at the proper pressure of 20 to 30 centimeters of water. What is the proper positioning for an endotracheal tube? The tip of the endotracheal tube should be placed approximately 2 to 6 centimeters above the carina as seen on a chest X-ray. How is the proper depth of an endotracheal tube assessed at bedside? Providers that intubate patients should always write an intubation note. This note provides valuable information for all care providers who may need to assist in managing a patient's airway. ICU nurses should know the proper depth of the ETT as specified by the intubating provider. The depth should be reassessed and confirmed at every nursing shift and every time the patient is moved or repositioned. Bilateral breath sounds should also be assessed and reconfirmed. What steps prevent airway pulling? The breathing circuit from the ventilator should always be secured. This will prevent the weight of the circuit from pulling on the ETT. There should be enough slack, however, to allow for patient head movement from side to side. Providers must securely hold the ETT and ventilator tubing for all turns and repositions. Providers must use vigilance in monitoring the ETT and patient circuit position during patient transport. What steps prevent dislodging the ETT? ETTs must be secured to the patient. Common ways to secure ETTs include tape and ties. After intubation, the size of the ETT and its depth should be clearly documented. The ETT should be held securely by a provider for all turns, during suctioning, and during transport. What steps can you take to prevent a cuff leak? Nurses should reassess the ETT cuff every shift. A properly inflated cuff prevents oral secretions from entering the lungs, causing aspiration pneumonia. The pilot balloon must be inflated, but not under excessive pressure. Excessive cuff pressure can lead to ischemia of tracheal mucosa and subsequent stenosis. Air leaks may be heard if the cuff is underinflated and should be corrected immediately. If available, manometers can be used to assess the pressure in the cuff. Goal pressure is 20 to 30 centimeters of water. What steps will prevent accidental extubation? Proper care and vigilance by the bedside ICU nurse is the most effective way to prevent accidental extubation. Securing the ETT during suctioning, turning, and transport are crucial. Patients must also have proper sedation in order to allow tube tolerance and to avoid self-extubation. What steps ensure the ETT is not advanced into the main stem bronchus? ICU nurses must know the proper depth of the ETT and reconfirm its position with every shift. Suctioning the ETT can lead to inadvertent advancement or withdrawal of the ETT. Again, nurses must secure the ETT for all suctioning. When should bedside nurses suction intubated patients? Suctioning of the ETT should occur for all visible or audible secretions, for increased airway pressures, for suspected aspiration of gastric contents, for patient respiratory distress, or a sudden decrease in oxygen saturation. Where should nurses suction ventilated patients? Nurses should suction inside the ETT and in the oral cavity for all the indications mentioned during the previous slide. What are the risks of suctioning inside the ETT? Suction catheters may be too large for the diameter of the ETT, which can block airflow to the patient. Nurses must use properly sized catheters and brief periods of suctioning. Advancing a suction catheter into the ETT can unintentionally advance the ETT. Holding the ETT securely during suctioning prevents movement of the tube. Patients requiring high levels of PEEP for oxygenation require special consideration. Disrupting the ventilator circuit and introducing suction will remove all PEEP and potentially lead to oxygen desaturation. How do nurses manage suction catheters and yank hours? Suction catheters and yank hours are potential sources of infection, especially when repeatedly introduced into patients' airways. Each catheter and suction device should be kept clean during storage, be cleaned after each use, and never be used on more than one patient. Ventilator-associated pneumonia is another common complication occurring in mechanically ventilated patients. Bundled care protocols have been shown to decrease the incidence of ventilator-associated pneumonia. Nurses should be actively involved in the development of these protocols for their ICUs. ICU nurses must recognize patient distress and activate an emergency response team quickly.